profile. Now, to tell us more about the campaign, we're joined via Skype by the City of Johannesburg's member of Mayoral Committee for Group Corporate and Shared Services, Loyiso Masuku. A very good morning to you, Loyiso. Tell us more about this campaign.
Morning, Desiree, and morning to the listeners at home. Thank you very much, Desiree. As a city, we realize that our essential services employees who are at the front waging this war against the COVID pandemic do at a particular point get anxious and do require that they become screened and tested. And we therefore took a decision that we are going to have a mass screening and testing campaign focusing on them. These Desiree would be our employees, for an example, who are your general workers, who are your pick it up employees, the JMPD officials who are on duty working daily to ensure that service delivery is not impacted in the city.
Is this move motivated in any way by the fact that Johannesburg has the highest confirmed COVID-19 cases within the province?
Absolutely, Desiree. You would know that as the epicenter, we are facing a challenge of where our employees are also living in our communities, so they are not isolated from communities. They live in the communities. They also interact with people. They go to shopping centers. But the least that we can do is to be able to ensure that in their environment they are given the service, which is to provide health screening as well as testing, but furthermore, as well as counseling in the instance that there is an employee that perhaps tests positive, as well as employee assistance for their families as well, because you would know that this is a pandemic and it's a new phenomenon for everybody. So there's anxiety from our employees, and we have realized that we cannot expect our employees to continue doing work, but we are not in a position to be able to at least assure them that we are taking care and giving priority to their health.
How's the city interacting with the information that the Alexandra Centon area is really proving to be a worrisome area in terms of infections? What is being done in this regard?
You will recall, Desiree, already as early as the 30th of March, the executive mayor and the Gauteng provincial MEC and the MMC for Health and Social Development, MMC Gcina, ran a massive testing and screening campaign in Alexandra. That was to particularly be able to make sure that people who are in the Alexandra area are screened and tested. The city went further at the end of April and also did another second round of the testing and screening. Desiree, what is important to note is that within that period, we have also realized that we have a huge number of recoveries coming from that particular region as well. So the programs, the two programs that I spoke about, have indeed yielded results, because when as a city and the provincial government, we go out to actually test and screen people, we are then able to manage the virus and get the people, those who need isolation with government facilities, get them into the isolation and give them their 14-week recovery, and so that they can be able to then go back into and integrate it into society. So with that particular area, it has indeed yielded good results, and the recoveries are quite motivating.
So with so much emphasis put on the screening and testing, what precautionary measures has the city put in place to protect its employees?
The city has procured PPE. We have to emphasize that we have procured PPE And if you understand the demand that has been there for this particular PPE, we've accepted that at the particular point in time, we can't bring everybody back. That is why we are phasing in the return of our employees to work. We are not having we're not using an approach where we're saying everybody in the city is just going to come back. We're phasing it in. We're doing it into categories. Even the mass testing and screening in itself, we're doing it in phases. So you've got category A, for an example. Category A would be these essential services employees. And then we've also got category B of our employees who would then be coming back. These are employees, Desiree, who would have been and are still working from home and will be gradually be coming back to work in thirds. So we'll do phases and thirds of returning them to work. And we have also done deep cleaning of our buildings. We have made sure that entrances have sanitizers, so when you come into the building, there's sanitizers and the basic soap dispensers. And what we also do, Desiree, we spend a lot of time communicating with our employees via SMS, via the intranet, which we call our JosieNet, and through our labor unions. We communicate so that we give our employees the reminders of the golden rule, because hand washing still remains one of the most critical ways in which you can make sure that you prevent contracting the virus. So we continue to communicate those golden rules, and we work very hard to instill social distancing. Our elevators, Desiree, are marked, so you can't enter more than 2 people in a small size elevator. You can't enter more than 4 people in the big size elevators. This is all in the interest of ensuring that the safety of our employees is attended to adequately.
You were talking about the demand for PPEs, but alongside that demand goes the fact that these products cannot be used long term. They have to be discarded. Is the city working on some sort of plan on how to safely and securely discard these?
Yes, Desiree. Coincidentally, yesterday we were discussing and speaking about waste disposal, not only for our city buildings, but also a program where we educate our communities. You know, Desiree, the call by the National Command Center and the Minister of Health was that we must all use cloth face masks. But reality is that we would have observed, and I'm sure you've also seen, that in the shopping malls, in the spaces, public spaces, people are still utilizing the surgical masks. People are still utilizing the gloves, even though we are told it's fine to just wash your hands and be able to sanitize. So we spoke about this yesterday, and we've agreed that it is important to also include in our environmental awareness campaigns the aspect of how we need to dispose of medical waste, particularly as we utilize it in our homes, as we continue to utilize it in our various spaces where we operate at work, as well as generally in public, for instance, in shopping malls, because, you know, you would be in a mall wearing a surgical mask, but then when you leave the doors and you exit the shopping center, you take off your mask and you just want to throw it in a specific bin that is an ordinary bin. And so we are definitely looking into the disposal of medical waste, as it has now become waste that is utilized by the public as well.
So finally, what other additional support will be offered to your employees during this time?
I did mention earlier, Desiree, that we've got an employee assistance program. You know, this pandemic brings about a certain discomfort and an issue of stigma and fear. Now, when you deal with fear of the unknown, you need counseling, you need reassurance, and you also need to know that your employer also is providing the necessary support. So that's one of the things that we're doing, and also extending to family members. But also, Desiree, through our collective work with SALGA, we are going to be providing compensation for employees. I think other people would call it danger allowance, but we like to refer to it in the City of Johannesburg as compensation for employees who are in the line of duty during this COVID-19 pandemic, because they have really put the citizens of Johannesburg first. They have risked their lives and are committed to serving. So as a caring employer, ours is to indicate and show them that we do care and we appreciate their contribution in assisting us to serve the residents of Johannesburg.
Loyiso Masuku, thank you so much for talking to us this morning.
Thank you so much, Desiree. Have a lovely day.
Fantastic. From the City of Johannesburg, talking about the mass screening and testing campaign aimed at benefiting essential workers in the City of Johannesburg. Let's take a break.